This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. K2 and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because K2 and Providence Health and Services know that family matters.
With the state about to open back up after many months of COVID restrictions, some people are feeling a little anxious about that. Here to offer some helpful advice, we welcome back Executive Director for Providence Behavioral Health in Oregon, Dr. Robin Henderson. Good morning, doctor. So do you have patients who are feeling really kind of anxious about things going back to normal?
Absolutely. Good morning, Helen. It's so good to see you. No, absolutely. People are feeling anxious. It's kind of like what we felt during the pandemic itself when people were so anxious. Everybody has a different comfort level about who they want to be around, who they're comfortable with, and how they're feeling about how they want to re-enter the world. So anxiety is pretty normal these days.
Yeah, I would think I've seen at grocery stores now in the Vancouver area where you can go in without your mask, and people are still wearing their masks. And I think probably we've learned a little something about that. So it's either we're anxious about coming back into the real world, or we think, oh, maybe this is good wearing a mask in a public place.
You know, there are many people out there who are immune compromised or who
Yes.
have complex healthcare conditions. And you don't know that. It's not like they're wearing a t-shirt that says, hey, I've had a kidney transplant and I'm nervous about going out in public. So we've got to all be sensitive to each other. But there's also people who were pretty socially anxious before the pandemic began. And so the idea of wearing a mask in public was pretty comforting to them. And this is, you know, a whole group of people who now are having been for a year able to indulge in that behavior, having to re-enter, and that's really tough.
Yeah, so those are the people that are having a little re-entry problems. That makes sense. Now, so let's say I want to throw a party in my backyard. Are there things that you think I should keep in mind?
Absolutely. I think everybody has a differing level of comfort these days. And so making the invitation available to people who you know are vaccinated or you may not know their vaccination status, but be upfront and honest and encourage people to ask you privately if it's okay for them to come if they aren't vaccinated. That's one of the biggest keys right now, is that people talk a lot about the right to whether or not they want to get vaccinated or not, but there's just as much a right for people who are vaccinated to be able to cohort themselves away from people who aren't, for reasons we may not know and may not understand. So try and make it possible for people to be comfortable. And if someone's just not comfortable coming to the party, that's okay too. Maybe there's a smaller gathering that they would come to.
When you're dealing with patients who are anxious, have a lot of anxiety about what's going on right now, I mean, how can they come out of this and really enjoy themselves?
It's a matter of dipping your toe into the water and taking a little bit more risk and a little bit more risk. I still know people who haven't been to the grocery store. So being able to go out and take those first steps and go out for a walk and go to an event, think about what it is that you're going to be comfortable with and push yourself.
I know that mental health professionals like you've seen quite a number of patients over the pandemic, as in an increase in patients. Is that a good thing? Do you see more of that happening?
I think it's a really great thing that people are embracing their mental health. During the pandemic, when we switched to a video platform in our primary care clinics, we saw more than 35,000 visits for mental health last year. That's a tremendously remarkable number just in primary care. The wait lists are really long, but it's actually really worth it. And if you're struggling with a mental health issue, it's really great to start with your primary care provider and see if they've got a behavioral health professional there on site who can see you. Generally, they can get you in a lot sooner.
Do you think that you will be continuing to do Zoom sessions long after the pandemic is over? Because I know some people who are anxious in general like the Zoom visits with healthcare professionals, mental health care professionals.
Oh, definitely. I think we're going to see a hybrid mix of this going on for a long time. We can see, for instance, college students that we've been able to see in person this summer as they transition back to school elsewhere in Oregon. We can follow them. We've been able to see people who have not been able to get to us because of travel restrictions. Maybe they live a long way away, or they've got a health condition that makes it very difficult for them to travel. So we've been able to zoom in and see them there. And most importantly, we can actually see people now and they don't have to wait for an hour in traffic.
There you go. That's a great reason. Dr. Henderson, thank you so much. We want to tell everyone if they'd like to find out more about mental wellness and get some support in that area, you can give Providence Health and Services a call, 503-216-2025. Thank you again, Dr. Henderson.
Thank you, Helen. Have a great day. Stay cool.
You too. We'll be right back with more AM Northwest. Don't go away.